I'm going to introduce you to our main presenters and hand it over to Katie Shorten from Research in Practice. Today also we have Ashley Sir from National Advisory Forum at part of Social Work England, and other two presenters, Catherine Witt and Philippa Jeets from Social Work England, my colleagues, Regional Engagement Lays 2. Katie, I will now hand over to you. Thank you.
Thank you so much, Iona. That's really great introduction. I think we all know where we're at now. Thanks so much. So if you could move on to the next slide. So there are a lot of us in the room today, but it would be really fantastic to connect with each other virtually. So if you wouldn't mind popping into the chat who you are, where you come from, and just a little bit about how you're feeling today. So you could do that with a GIF or a visual or a number or a word, just so that we can see who's in the room and connecting with each other. And while you do that, I shall get on with the session plan. So next slide. So just to give you a bit of an overview of what we're going to cover today, I'm going to do the content-y bit, a bit of knowledge giving for the first part of the session. So an introduction to professional curiosity, and then doing a little bit around definitions and some of the evidence that sits behind it, before handing over to Catherine and Philippa to talk about how professional curiosity links to the standards within Social Work England. And then Ashley's going to pick up some of the really important bits about bringing what I've talked about to life with some discussions around a case study. You will also then be going into breakout rooms and having some reflective discussions yourself before coming back into the main room. So that's the plan for today. We move on to the next slide.
Katie, if I can come in, I should have remind myself to mention that we do have in this meeting also an illustrator, Carrie from New Possibilities. Carrie, do you want to come and say hello? I'm so sorry. Just to say, towards the end of the session, we are also going to see the amazing virtual illustration from this workshop discussion. Good morning.
Hi, yeah, I'm here. As you can see, there's a bit of white paper behind me. So everything that you discussed today will go up onto that board, and I'll tell you all about it at the end.
Thank you so much. Thank you, Katie.
No problem. Really excited to see what visuals come out of the conversations that we have today. And it's great to see some smiley faces in the chat box as well. Thank you for doing that. So in terms of learning outcomes, we hope that the session will grow your understanding of what professional curiosity is, why it's important. We'll be able to explore some of the barriers and enablers, both a little bit in this session and then also through the discussions. And then it will be great because you'll be able to understand more how professional curiosity links to Social Work England standards. Next slide. So to start off the evidence definitions bit of the session, I thought we could start with this quote, which is quite, it's got in its foundations, it's got a fairly well-known everyday quote that people use, but I'll just read through it. Curiosity is the very basis of education, and if you tell me that curiosity put the cat in danger, I say that it was only in noble pursuit. So just breaking that down a little bit, curiosity is the very basis of education, and when we say education, we mean education in its broadest sense. So as well as traditional or formal routes of learning and development or training or from institutions, we mean education in our everyday life, thinking about exploring and being curious around the situations that we're facing, our reactions and responses to the situations we're facing, educating ourselves about what's happening in our day-to-day practice. If you tell me, so when we talk, sorry, can we go back to that slide? Thank you. If you tell me that the curiosity put the cat in danger, so that second bit, breaking it down a little bit, being curious requires us to ask questions that may feel a bit tricky or challenging or difficult. You might not be sure, for example, what response you're going to be, what response you'll get from asking a question or exploring something in more detail, or you might be unsure around how you're going to respond or react to something that you come across. So there can be a sense of discomfort, sometimes fear, when you're going into a situation where it requires you to be curious. So it's just acknowledging that and acknowledging that discomfort. However, when you speak to social workers across the country and across the world, it is absolutely something that is at the core of social work practice. We all have a responsibility, if we're going to do a good job, to be curious in our practice. So that's just a start in terms of setting definitions. Next slide, please. So Thacker et al. In 2020 wrote a strategic briefing for us, and this is actually hyperlinked onto these slides. So when you get the slides, you will be able to click on that link and it will take you to an open access resource on the Research in Practice website. So Thacker et al. Talked about professional curiosity as being quite ill-defined in practice. It can mean, it's a well-used term, but it can mean different things to different people. So what they felt was actually it can be usefully defined as a collection of personality, attitude, behaviour and skills that come together to create professional curiosity. So personality being around people where they enjoy gathering knowledge, enjoy seeking to understand and grow their learning in a situation, and also being comfortable with uncertainty, where they might be open-minded and strength-based, really interested in people's stories and people's stories from, crucially, their own perspective, being questioning and willing to challenge, willing to ask those difficult questions and really explore and get underneath what might be happening. And importantly, again, reflection. So thinking about how you might be responding to a situation, what that might mean, how it might have impacted on the other person. So skills around reflection and analysis and analysing and thinking things through. And of course, skills in terms of the underpinning legislation within which we work. So just to start off with a bit of interaction, I'm going to ask Iona to launch the poll, which asks you, which of these collections do you find most helpful in your professionally curious practice? Professionally curious practice. So hopefully the poll will come up in a moment.
Yes, and it's really important to mention that for those of you, if you look at the top of your screen, you should see next to the chat bubble and reaction a little square box saying polls. If you click on it, you should be able to see and vote.
Okay. So I can see that when I look in the chat, I can also see the responses. So it's really interesting. Can everyone, hopefully everyone else can see those responses as well. It's looking like outlook, so being open-minded and strength-based and interested and questioning and challenging are the most useful or what people find most helpful in their practice.
Beverly, we hope you might be able to see at the top of your screen is near reactions little tab. It's written polls. If you click on it, you should be able to see the question.
Great. Well, we've got 72 responses so far. That's fantastic. And it's and really interesting for us all to think about and reflect on perhaps that the outlook, so open-mindedness, being strength-based and interested in stories, and the behaviours around questioning and being willing to challenge. So in practice, how we're behaving and we're interacting and having conversations with people are the things that you guys in practice find that most helpful or most useful in professionally curious practice. I wonder whether there might be something to think about in terms of the lower figures there around skills in reflection and analysis and kind of those personality traits. Okay, so that's fantastic. Thank you so much for taking part in that poll. I'm going to move on now. So if we could have the slides back
yes. Up. Thank you. I think someone is trying to take over the slides, the presentation. I'm so sorry. Hopefully that person is going to let me have the slides being shared. Thank you so much. All right, this is the next slide.
Fab. But also, I just wanted to pick up, thank you, Leo, so much for your comment in the chat. Absolutely, they are all interlinked and all hugely important in professional curiosity practice. You get the gold star for answering that slightly trick question there. Thank you very much. So I've mentioned a couple of times already in this presentation so far around challenge, and I wanted to unpick that a little bit more. So professional curiosity and challenge are both consistently highlighted in serious case reviews, in safeguarding adult reviews, and in case law, where if people had been more professionally curious or if there had been more challenge, there might have been a different outcome, or things might have been different. So, but crucially, in combination, the two can reinforce one another. So challenge is hugely important to professional curiosity. And I thought it would be useful to go on to the next slide to explore the context of social work and the context within which you're working a little bit more. So if we could move on to the next slide. Thank you. So this is taken from Gallagher et al. In 2020, and it's the results, summary results of a survey they completed exploring reasons for complaints and opportunities and ideas for reducing complaints within social work. And what they identified through their conversations with social workers was that social work is an evolving profession. We change and we respond and we learn and we grow all the time. And that changing and evolving context can open us out to challenge and feedback and complaints. The work that social workers do every day involves challenging practice, challenging our own practice, other people's practice, and indeed challenging and working when we're working with people in direct practice. And again, of course, that's an important, hugely important part of our practice, but it can open us up. Social work takes place in a pressurised environment. So we're seeing people and working with people at some of the hardest times in their lives, and we're going into and often having to respond and react to difficult situations that stretch us. And we're not always going to get it right. So just acknowledging that social work takes place in a pressurised environment. And then finally, what the survey picked up was the impact of public perceptions and expectations of social work, often being negative and unrealistic. So all of these things combine to create that context within social work where challenge, feedback and complaints are part of the work that we do. And so I just wanted to acknowledge that when we're talking about professional curiosity, that this is part of our work, and invite you to think, how aware of you are part of this job? How do you respond to it, and what helps you? What support can you get, and what support can you look for when recognising and acknowledging this context within which you're working? Okay, next slide, please.
Katie, I'm aware that there are some comments in the chat that people have wanted, some people are unable to see the polls, unfortunately, because of Microsoft Teams probably version, and we are really, really sorry about this. I wonder if you want maybe just to reiterate the questions there were in the polls, because some people might still want to contribute to that conversation. I'm so sorry, you decide.
Absolutely. So the poll was asking which of the professional curiosity those collection of traits do you find most helpful in your professionally curious practice? We had 83 responses, and personality, so enjoying knowledge and being comfortable with uncertainty, received 12% of the votes. Outlook, so open-mindedness, being strength-based in your approach, being interested in stories, received 57% of the vote. So that is by far the most useful thing that you guys feel, or the people who complete the poll felt supported and helped them in professionally curious practice. Behaviours around questioning and being willing to challenge received 20% of the vote. So that was second. So again, how you're interacting and how you're having conversations with people is most useful in professionally curious practice. And then at only 11% were skills. So skills in reflection, in analysis and in legal literacy received 11% of the vote, which is super interesting in terms of, I suppose, thinking about where social care and social workers' opportunities for reflection might be happening at the moment. So that's hopefully a summary of the poll results for people who weren't able to see them.
Thank you so much.
Okay. And thank you so much, Heather, for your comment in the chat around I don't feel I'd be doing my job properly if I never had a complaint. That's really, really fantastic feedback there, and really talks to that last slide that I mentioned. So defensible, this is a reminder, Kemshall in 2003 talked about defensible, not correct or defensive practice and what that means. And professional curiosity absolutely underpins defensible decision making and defensible practice, ensuring that reasonable steps are taken. You know that you've gathered the information in the way that works for that person and it's reliable. You've evaluated it thoroughly, and any decisions that are recorded and carried through. Processes and procedures are followed, and practitioners are using an investigative and a proactive approach. So that's just a reminder of how professional curiosity underpins defensible decision making. Next slide. So now hopefully we're going to have an opportunity to put some stuff in the chat. I'm so sorry for everyone who weren't able to see the poll and aren't able to see the slides. I wonder if going back, actually I'll leave that to the tech people who are much better at knowing solutions to some of these issues. But if we could use the chat just for a moment to think about barriers and enablers. So from what you've heard so far about professional curiosity, I want to invite you to, just for a minute, pop into the chat anything that you feel gets in the way of curious or constructive challenges. Is there anything that anyone would like to reflect on? Excellent. Time and workload, really important, some of those practical things. Confidence, absolutely. Some of the conversations that people are going into require courage. We've got a webinar, a briefing around courageous conversations that we're just about to release at Research and Practice. So fatigue and stress, absolutely. Tiredness and overworking. Culture, absolutely. In order to be professionally curious, we have to be working within a culture that enables that. Brilliant, some excellent comments there in the chat. Values and culture coming up again. Workload, capacity, competing demands, time to reflect. And again, Teresa, that's an interesting point in terms of that poll result as well. Reflection was lowest, surprisingly lowest on that poll result in terms of helping with professional curiosity. So time to reflect, is that something that we need to think about and look at in social work practice? The ability to reflect and supervision. Okay, fantastic. So that's the barriers. I'm going to move on to the next slide into a more positive note and think about some of the enablers to professional curiosity. So please use the chat again to think about some of those enablers. And it might be that they're kind of the opposite of what we've just talked about in the chat around barriers. But yeah, please do start at good management and support and supervision. Fantastic. Relationship-based practice. Yeah, having an open dialogue and having a safe space. Look at that. Look at all of the space to reflect and reflective supervision. Supervision are absolutely enablers. Good training, MDT, partnership working. Yeah, that's going to come up a lot in the discussions, I think. Clear processes and good teamwork. Fantastic. You know all of this stuff. You know what you need to be professionally curious. Okay. Thank you so much for that. Thanks for that. And as those keep coming in, a lot on reflective practice and a lot on supervision. As those keep coming in, I'm going to move on to the next slide so that we can. So building on what you've just talked about in the chat box and the information I've presented so far, I just wanted from the evidence to pick out some of the things it might be useful for you guys to look out for in practice. To support and enable, or when you're trying to be professionally curious. So Shahid and Forrester in 2012 separately talked about keep out actions, and these are actions where fear or shame or confidence or ambivalence about something that you're asking may cause a person to just put up the barriers or make you feel like there's something that this person doesn't want me to see or hear or believe. But what can be behind that is some of those emotions that can be supported by asking inquisitive questions around. So just keeping it, so watching out for how people might be feeling in response to the questions that you're asking can result in some of those keep out actions to watch out for, and it might be that a different approach or asking a question in a different way might help. Thinking errors come from Grant and Kimman in 2014, and these refer to kind of the patterns of thinking that have evolved over time that can distort people's views. So really watch out for a person's self-narrative or your own self-narrative around that might be preventing further exploration or action from being taken forward. And that leads on to kind of bias. So we could do a whole workshop and a whole presentation on bias, so I'm not going to say much more about it than kind of biases talks about factors which influence perceptions and beliefs and decisions, and we all have them. So just being mindful, conscious and aware of our own biases and the biases of the people we might be working for. So nosiness and being judgmental, and this can be seen as a kind of tactical, a self-tactic to not be professionally curious. So if you feel like by asking that question, being nosy or might come across as being judgmental, just check in with yourself. Where is that coming from? Why is that? It might be that there's some tactic that we might be using in order to not ask a question or wonder what they kind of. So it's worth reflecting on if that's something that you're feeling. Just look out for it and see, and have a chat with your manager or through supervision or peers around what might be happening. Cultural relativism and natural love, the rule of optimism, all refer to kind of our kind of just things to watch out for, our kind of hope for the best situation. And uncertainty or anxiety, hopelessness or despair. Burton and Revel in 2018. Kind of absolutely, anxiety is a predictor for diminished curiosity, and it really impacts on our ability to think and think clearly. So it was really interesting to see in the chat when we were talking about enablers, that opportunity for reflection, that opportunity for supervision is so fundamental and crucial for professional curiosity, because having that safe space to talk about your uncertainty or anxiety within a situation will really help with professional curious practice. So next slide. So, and actually we're going to skip that one, so into the next slide. So I've talked quite a bit about individual practice and professional curious practice, but absolutely organisations can support professionally curious practice. It's not possible to be professionally curious practice in the best way that you possibly can without support from your organisation. So these are some of the things from evidence that I've picked out that can help, where organisations, where you can ask for your organisation, or if you're a leader in your organisation, you can think about what you might be able to do differently to support professionally curious practice. So gathering feedback from people, if your organisation is interested in complaints or collections of complaints and patterns of complaints, and listening and hearing and responding and changing things up, then it's likely that your organisation will be supporting you to be professionally curious and cascading that information, that culture down through in terms of listening and hearing people's stories. Those next few, time and capacity, structure, working practices, recording process and procedures, all came up as barriers to professional curiosity. Really can be really super useful to reflect on all of those, that infrastructure within which your teams are working, and see whether are these enabling professionally curious practice. How can I talk to my teams or my practitioners to see what can we do differently to prompt professional curiosity within our recording, for example, or to enable space for reflection, or how can we create that time and capacity to enable professional curiosity. Supervision and support, that really should be flashing in big lights, really, because as we know from the chat box when we were talking about enablers, reflective supervision, space to reflect, supervision, supportive line management is fundamental to creating that safe, trusted space where you can feel contained in order to have conversations and think about the challenging conversations that you've been having. Learning and development, including that underpinning of legislation that sets that framework and boundaries for professionally curious practice is very important, and a way in which your organisation can enable you to practice in that way. Culture, having an open culture and leaders leading by example, really modelling being curious and interested in your stories as a practitioner and in the stories of the people that you're working with. And being open to challenge themselves. So think about the culture within which you're working, thinking about how can we grow and develop that lens of professional curiosity across the organisation. And then finally, partnership work I want to pick out, because gathering information from a wide range of people partnerships that are working with the people and families that you're working with really strengthens your ability. If those good strategic partnerships are working, then it really strengthens the ability in practice to be information sharing, having good multidisciplinary teams that talk to the same culture and structure. So that's a little bit just emphasising the importance of organisations in supporting you as individuals practising curiously. Okay, next slide. So I'm going to whiz through these because we've got a couple of minutes before handing over to Catherine and Philippa. So this is open access on the Research and Practice site, and there's a link there. So the social graces is a really useful tool for thinking about how you would describe your identity as a person. And when going into a professionally curious conversation where you might be challenging or asking people to share things in a detailed way, it's important to be thinking about, how am I going to be coming across? Who am I? How do other people perceive me? What are my voiced or unvoiced social graces? And how might that impact on the relationship I'm about to have? So this tool can be useful in supporting you to reflect on your own identity and the power that you might hold in that conversation, so you can see yourself in the context of this, the conversation you're about to have, and how you might frame your curiosity. And if we go on to the next slide, there's just a picture, which we don't have time to go through now, of the social graces, but please do hop onto the website and you can download it yourself. If you scroll up to the next slide. So these are things to consider in preparation for a conversation. So what information do you have? Where's it from? And what information do you need? So where has that come from? So what are the gaps? And what might those things mean? Reflecting on how a conversation might go and what might be difficult for you. So just some prompts there in terms of what might need to be considered when leading up to a conversation. And the next slide this is Winnicott's discrepancy matrix, and again that is a hyperlink at the top there. So when you get the slides, you'll be able to click on that slide and it will take you to this tool on the Research and Practice website. And Winnicott's discrepancy matrix really helps you to think about, what do I know? What am I pretty sure of? What's ambiguous, or what assumptions am I making by that information, and what is missing? And so just setting out that information about what you know ahead of, whether it's kind of through a referral documentation that you've received, or whether it's as part of a conversation that you're having. If most of your information is in that top left-hand corner, then you can be pretty confident about the information you've got, but actually it starts to help you to think about where you might go for more information to help you in your curiosity. So that's another tool that might be useful. And if I scroll on to the final slide, so again, that is also a hyperlink on the powerful questions bit there. So if you click on that when you get the slides, you'll be able to go to the tool. And it's just a suggestion around what powerful questions, being the foundation of curious and constructive challenge. They help to expand possibilities and focus attention, or bring underlying assumptions to light. And they can really help ground and support someone to think about moving forward. So moving away from less powerful questions, yes, no, and which are super important in terms of gathering facts, but then moving towards more powerful questions to really understand and explore what might be happening. So the who is hugely important in terms of who's involved in this situation, who else when, where, what, how, why, and what if. So that brings my section to a close. That's most of the kind of evidence, definitions and content giving. I'm really pleased to hand over to Catherine and Philippa, who will be taking forward the next slide and talking through how professional curiosity can relates and links across to Social Work England standards.
Thank you so much, Katie. Catherine, before you take over, can I just add here a gentle reminder for the participants, please to switch off your cameras. I can see also child, and I think it's to remind ourselves that this video is going to be visible, and recorded session is going to be visible on YouTube, and I think it's really important. Thank you so much. Just gentle reminder, please consider turning your camera. It's also aiding connectivity and brings a better experience. Thank you so much, Catherine. And Philippa, please come in. Thank you.
Thanks very much, Joanna, and thanks, Katie. I think you just did an amazing job covering the whole of professional curiosity in about 20-25 minutes, and so calmly as well. But yeah, really, really useful. And I think the slides will go out, so you will have access to that. So I'm Catherine Witt, and I'm the Regional Engagement Lead for the North East and the Humber. And Philippa, do you want to introduce yourself?
Hi, I'm Philippa Geddes. I'm the Regional Engagement Lead for the Southwest.
Brilliant. So we've covered with Katie's session her input around the theory around professional curiosity, and it's really great to move into the sort of professional responsibility around professional curiosity. I've been 30 years in practice and have been really interested in professional curiosity all the way through my career. It's not always been called professional curiosity, and that's really interesting to sort of look back on. But having seen what a lack of professional curiosity can lead to is really quite significant when I look back on my career. And I certainly know the best practitioners that I've worked with have approached their professional role with an open mind and an ability to see things through a different lens and to see things in 3 dimensions. And if you just want to click on the little photograph, that's next. Is it Jack, you're doing the slides? Yeah, and I just think this really sums it up. It's about what we see and where we see it from, and we all see things and we're absolutely sure about what we see, but actually if you move around a little bit you can see something quite different. So if you want to move on to the next one. So the professional standards, and hopefully everybody is aware of the 6 Social Work England's professional standards. They are the only mandatory set of standards that we have as a profession. They're 6 beautiful things, and they should direct and embed everything that we do. But professional curiosity really sits very firmly in particularly 3.5, which is to hold different explanations in mind and use evidence to inform my decisions. And it really is, it's about a professional requirement to be professionally curious. And I think what came out in the poll was actually it takes time. And that is the bit that I suppose we need to reflect and think about. But it's not a quick fix. And to be professionally curious can actually delay things and can be something that is really, really time consuming. Just go on to the next slide, please. Yeah, this was interesting when I was looking at professional curiosity, and they do a sort of a 3-yearly review of serious case reviews. Interestingly, the last one is 2017, and they haven't done another one since. But when we can see that the biggest issue, the frequency of the themes that came out, that professional curiosity was second, just after information sharing and communication between professionals and agencies. And I think that's quite significant. The analysis in 2011 and 2014 referred to lack of professional curiosity 18 times, and the review in 2014 to 17 referred to it 11 times. So we're not getting that much better at being professionally curious, particularly when it comes to the safeguarding and protection of children. So just something I thought was of note. Next slide, please. But whilst 3.5 is a very significant responsibility for professional curiosity, we have a number of other professional standards that link to almost everything that's been said in the earlier session around the theory. So to practice in ways that demonstrate empathy, perseverance, authority, professional confidence and capability, working with people to enable full participation in discussions and decision making. 2.5 is to actively listen to understand people using a range of appropriate communication methods and to build relationships. 3.2, use information from a range of appropriate sources, including supervision, to inform assessment, to analyse risk and to make professional decision. And it's music to our ears when we heard what we saw in the chat, so many references to supervision, reflection, and that's what we're trying to build with our CPD requirements. It is about that deepening of our continuing professional development that is linked to theory, is linked to professional responsibility, and is linked to being the best possible practitioners that we can be. Next slide. So 3.4 is to recognise risk indicators of different forms of abuse and neglect, their impact on people, their families and their support networks. And really interesting in the series case review in the earlier one, the 2011 one, that professional curiosity was around this sort of CSE and a lot of the Rochdale issues and child sexual exploitation. And it was that lack of professional curiosity that led to that. So that was quite interesting. 3.7, recognise where might be a bias in decision making and address issues that arise from ethical dilemmas, conflicting information or differing professional decisions. 3.9, make sure that relevant colleagues and agencies are informed about identified risks and the outcomes and implications of assessments and decisions I make. And 3.15 is to recognise and respond to behaviour that might indicate resistance to change, ambivalent or selective cooperation with services, and recognise where there is a need for immediate action. And again, you know, that lack of that disguised compliance, lack of engagement, or over engagement, we always have to ask the questions. And I think there is something about that, just the questioning, the important questions, and going deeper and beyond what we can see. I've really rushed through our professional standards and professional curiosity, but I was given very strict instructions because we have got our next part of the session is about the professional activity and how we do this and the real life. Is there anything, Philippa, I've left out or that you want to say? Just do another little click on the slides.
Yes, thank you.
So when you change the way you look at things, the things you look at change. And I think we just need to hold that in our head. So over to Ashley, who's going to take the next bit of the session and to really focus on that, linking the sort of the theory to the responsibility to the practice. And I think that's probably the hardest bit. So thanks, Ashley, and really looking forward to this bit of the session.
Hi, good morning everyone. My name's Ashley. I am a National Advisory Forum member for Social Work England, a Children's Commissioner at Richmond and Wandsworth Councils based in Wandsworth, and I am also a Specialist Engagement and Service Improvement Worker as well. So we're bringing you on to the next part of the session, which is to link what we've learned to how you apply it into practice. But before we go into it, what we thought would be really interesting is to give you a case study. And I'm going to go over the case study in a second and let you go out into some breakout rooms for 10 minutes and think about what might be happening for this child and their family. And then we're going to come back and have a bit of a discussion and look at how professional curiosity can be applied. I would ask that we've given you a lot of learning today, but really try and work in a way that is your usual way of working, because it would be nice to see how different information comes out from you organically as well. So the case study is about child X, who has attended a police station on the 24th of December in the afternoon. They are alleging assault by their mother 2 days previously, and the police station they've attended is 10 miles from their home. Child X are making a statement at the moment and having evidence collected, but we've had something pinged over from the police station to say that this child's there. The only known details at this stage about the child and the family are that child X is a 15-year-old female with no previous missing episodes, is currently using a school counsellor with no referrals received from the school. The mother is 32 years old, single parent, employed as a teaching assistant. There's also child Z in the household, who's a 16-year-old male and a half sibling to child X. They're attending a local private school. And for the wider family details, the only information that we've got from this first referral, which we know often happens, we have very limited information to start thinking about and making decisions on, is that child X lives at home with mum and child Z. The family have moved a lot of times across the south of England, and child X and Z use also known as surnames instead of the surnames that they have by law. So if we go, don't go on to the next slide, actually, please, because that's some additional information we're going to give you later. But we're going to go out into the breakout room. Let me just double check something. Okay, no, we can go on to the next slide because it has our 2 questions on there. Is what are your first thoughts about this referral and what might be happening for child X? And how or where would you gather additional information about the family? So when we assign you into the breakout room, you're going to have about 10 people in there. To make it feel a little bit more welcoming, I would say that if you're comfortable to, when you go out into your breakout room, turn your cameras on so you can feel a little bit more like you're bouncing off each other in your conversation. The breakout rooms will be automatically assigned, so you don't have to worry about doing anything. You will just pop over into one and they will also pop you back when you're finished. If you have any issues in your breakout room with your connectivity, or you end up going into a breakout room by yourself, please just click leave and you'll automatically come back into this session. Okay, so we'll start a bit of a discussion now, so there's not too much of a break, and I'm sure that anybody that is joining in after will be able to follow along with what's happening. So we would ask if there are 2 or 3 of you that would like to use the hand function to give a very brief summary of some of the main points that your group thought of in this discussion. Apologies, because we will be only able to pick 2 or 3. So this is some of the missing information from the initial referral that you've received a little bit later. So there's been 2 previous hospital attendances of child X with injuries not consistent with given explanation, parental ill mental health and a previous breakdown. Mum has fled domestic violence 10 years previous, and family has lived in a women's refuge for a period of time. Family are in financial hardship. The family has presented as homeless at multiple times, with 9 total known previous addresses since the children were born. 3 previous referrals have been received about family with different local authorities that weren't followed up due to moves. So we're going to ask you just in the chat quickly to say, how has this additional information made you feel differently about child X and what might be happening? And what additional area might you now explore to get the fullest view of the family? And we know when we're working with families, it is often that we get a little dribble of information at first, and as we continue to work with them, we start to get a much fuller picture of what's going on for them and their history. So if you want to pop in the chat what you feel has changed and how you might feel differently about child X's case. And what area might you now explore? So we've got what stresses are impacting mum and how children's services can offer support to keep the family together safely. We've got indications of early trauma and attachment difficulties, possible exploitation, a strategy discussion to gather information from medical professions. Is child protection needed? Financial, somebody's picked up on the date. Christmas can be a very stressful time. How is mum's mental health? Adult mental health input. Referral to safeguarding family assessment. You need to talk to the child and get their views. Exploring of DV. What's the nature of the previous local authority referrals? Somebody said their concerns have increased. They now feel there's an immediate safety for the child. Where are the funds coming from for private education? So we can see that this has got us thinking in a different way now, because we have more information to enable us to be professionally curious.
Ashley, someone has also noted that mum is in a position of trust, and therefore as a teaching assistant, whether there may be, you know, a LADO referral around her, if the allegation is about her. So I think that's sort of also quite interesting.
Sorry, they're coming in the chat so quickly.
Absolutely. People are on fire now.
I know, we've got you all fired up of how you can use it in your practice, which is amazing to see. So if we come on to the next slide. And a bit of a disclosure here as we come into discussion. Child X is me. I am Child X. I am a care leaver that was taken into local authority care. I want you to feel all comfortable that there are no right or wrong answers. I've worked in children's services long enough now to know that all we can do for families is try and figure out what's happening for them, and there are no right or wrong answers. In terms of what this looked like for me, at the time, having this referral and having not much information known about my family, it was very difficult for them to understand what to do for me and how to help. There wasn't a look into a lot of the wider issues for the family. They did look at me in silo. They missed opportunities in terms of looking at it in a multi-agency way and thinking of it as a family. We often think of children's and adults' social care as quite separated. And actually, if we look at children or adults that we need to safeguard as a part of a family as a whole, it helps our approach a lot more. In terms of what was happening on the ground for me at the time, there had been a long history of issues within my family, and because we had moved so much, it made it very difficult for each new local authority to pick up from. And there was a missed opportunity that people didn't work backwards with us as a family. They always dealt with the immediate issue. And that meant that decisions were made based on very limited information at the time on what they thought might be the right solution for me in that very moment. But nobody was really saying what has happened for this family in the past that's brought them to this point. Why is this young lady turning up at a police station on Christmas Eve instead of wanting to be at home with her family, settled, excited for Christmas morning the next day? One of my referrals actually had me down as manipulative because I didn't want to go home. Instead of questioning why somebody wouldn't want to be at home so severely. And because of missed opportunities at that time, it meant that after the police investigation was concluded, I was actually put into emergency care on Christmas morning. And after that time, I was returned home for a week. And it was me having to really advocate for myself and saying, this is not a safe environment, that they still placed me back into, that later on ended up allowing me to come into local authority care. So knowing all of this now, I want to speak to you about some of the ways that we can apply it in practice. And for me, I think one of the most important things was feeling like I was dealt with in that initial moment and there was no exploration as to why. Why was I here now? What had happened? What had brought me here? But also what had gone on for all the years. And I think that was a theme that ran into when I did come into care. Nobody explored the history of the family. It was that I was safe now, and that's where it ended. And that's a way that we improve our practice. We improve our practice by not thinking professional curiosity stops at the moment an immediate solution is found, whatever that solution may be. So that means that we continue to explore why, and the person we're safeguarding, whether it be an adult or child, can help us understand opportunities that we missed in our professional curiosity so that we can continue to develop it and do it better next time as we work with more families. So there's key things here that really, really help us to be professionally curious, and one of them is gut instinct. Gut instinct. We all know whatever job you do, whether you're in adults, children, sometimes we have that little niggling voice at the back of our head that says, there's something more to this, or something about this makes me uncomfortable, or I feel like I've not got the full picture. Trust your gut instinct. And part of professional curiosity is that it's our individual responsibility as well as the organisation we work for. So that means that if there's something that you feel as though you need to be professionally curious about, it's also your responsibility to try and get some of those answers. Some of the tools we can use is a day in the life of the child and family. And it's important to note that that's child and family. Sometimes the work that we do, we look at day in the life of a child or day in the life of the adult that we're trying to safeguard. But actually, if we map out this family and we look at what's happening for each of them in 24 hours, instead of our 1 hour visit, what happened before you arrived? What happened after you left? What time did they wake up? Did they eat? Have they got a good family structure in place? Are they well looked after? What happened the day before? And these are questions, important questions that we can ask ourselves. Effective multi-agency working. We have such a wealth of resources when people come in. So for my family, as well as the police station, as well as children's social care, there was an opportunity to match up with adult social care, with adults' mental health, with the homeless teams within adults, with the different local authorities that I'd been with previously to try and get a full picture of what was happening. And that's with all of our cases. We've got a lot of agencies that we can connect with, and sometimes it is just as simple as reaching out and saying, we've had this referral, do you hold any information on this child, on this family, on this adult? Hidden figures, and we know in a lot of the serious case reviews in the last few years, hidden figures has been a key part. It's not just about hidden males, and sometimes we do hear a lot of the terminology around hidden males, and I really believe that this is hidden figures. What hidden figures are there in this family? And that can be through people directly connected, wider family members, but it can also be extra people that might not be known to the family in a direct way that could impact on the safeguarding and well-being of the family, the adult or the child. Our social graces. What is our own bias? And one important thing here that you might have heard of before is halo blindness. Halo blindness happens in our practice when we deem somebody as unable to do things wrong because of the position they're in. And in the case of my mum as a teacher, it was often thought, she's a teacher, it's a trusted profession, she's okay. And much picking up on Philippa's point, it's nice to see that people are able to have a look wider at actually somebody being a teacher, or you could be a social worker and still have a safeguarding issue within your family. You could be the Prime Minister and still have a safeguarding issue within your family. There is no title, there's no role that makes you ineligible to be looked at in the safeguarding of children's families and adults. In terms of social graces as well, it's understanding our bias and the way that our bias impacts us. Our bias can make it that we over safeguard in some situations and we deem people in need a bit more and we deem others in a bit less, and especially true in the cases of equality, diversity and inclusion. Taking personal responsibility, asking what if I don't do something? What if I don't ask this question? What is the result for the people that I'm helping? Searching for additional information and also understanding our bias and challenging our barriers also. So I know we heard earlier that workloads, and we are all aware that workloads are incredibly high. But one thing that I would question and push for you all today is that getting it right once for a family can reduce the workload by finding the right solution at the right time. And instead of having people trickle in and out for years and years, having cases opened and closed and opened and closed and opened and closed, if we find a solution once, it actually reduces workload because we're not having to revisit that loads of times through the courses of the year for the family and find new ways of supporting it. It isn't all about questions either. There's lots of different ways, and like we've said, gut instinct is a core one of them, but also it's about how does this make you feel? How does the child feel? What does the environment look like? What does the environment feel like? What might you not have or not know in that moment? And also piecing together information. Sometimes social work requires us to be a bit of a private investigator. And it's important to acknowledge that sometimes we might not be an expert at that. Who can we ask around us about how we can do it better? How can we continue learning? How can we look for resources that support us to be curious? So for one of these last slides, I'm just going to read to you something that I've always put together in my professional curiosity trainings or discussions, is that professional curiosity is a cornerstone of social work practice, especially when handling referrals with very little information or working directly with children, adults and families in need. It crosses adults and children's social care and the many agencies involved in a family's life. And although a cornerstone of social work practice, we're able to all apply the lessons to safeguard the vulnerable in our communities.
I just want to say once again, thank you to all presenters today and all my colleagues as well, Catherine and Philippa, for supporting this session, and really, really insightful for me as well as a social worker. Please remember that this session is going to be easily recorded. You're going to see the illustration as well is going to be made available towards the end of the day or tomorrow morning, probably on Twitter, on other social media channels. We use as Social Work England. And thank you so much, Kerry. It looks really great, including a list of triggers to consider for. Hopefully that image is going to be supportive to all training courses and other sessions you might want to utilize. If you are a social worker, very quick reminder that you can use this session as an opportunity for CPD. You might also want to utilize the reflection and the thoughts from this session in a discussion with your peers, and therefore hopefully that's going to support you to meet that requirement around continuous professional development. And we really hope you have enjoyed this session. I'm aware it's 11:30. We really hope you find it helpful. Remember, the recording is going to be made available. I'm aware that Jack has recorded this in the chat on our YouTube channel at Social Work England YouTube channel, and equally the slides. I have seen lots of questions about the slides. You are going to have them available. Please email us a Social Work Week email address. You have already been given probably in the chat.